Hi, namaskar, dear students. In management of hypertension, we have covered various different medications in this class and this group. But today we are going to focus especially on one of the medication that is very, very important because that medication has so many different user cases and that medication has a very broad spectrum uses and side effects. So you are expecting to get the questions in your examination and also in your real life practice. You are going to come across that medication very commonly, very oftenly, because there's a huge different kind of indications of that medications. Yes, today we are going to discuss about the Clonidine. Okay, that is one of the best medication for your exam preparation, and you are going to definitely you are going to get various questions from the Clonidine. So you have to learn that medication much in a detail. Okay, so let's focus on the Clonidine. This Clonidine, look. This the indications. Okay, there's the indications of Clonidine that use for hypertension, obvious, treat for menopause flushing. Yes, that medication used for menopause flushing. And yes, this medication used for menopause. Okay, so those female who are not tolerating the medications like hormones, okay, estrogen supplements, if they are not tolerating the estrogen supplements for maintaining the menopause symptoms, in that situation we can give the Clonidine as a medication for menopause. Diagnosis of the pheochromocytoma. Okay, diagnosis of the pheochromocytoma, Clonidine can be used. For ADHD, this medication can be used. For opioid withdrawal symptoms, those who are misusing the opioids and they want to get out or they want to just recover from the opioid habits, Clonidine is the best medication for using such kind of minimizing the withdrawal symptoms associated with opioids. This medication used as a adjunct with the analgesic, and also this medication used as adjunct in anesthesia. That means the Clonidine has a diversified user cases. That's why this become the ideal candidate for your exam preparation. And that kind of techniques and tricks you must have to apply in your real life practice because you are preparing for the examination. So most important in IMP medications you must have to learn in details. So you are going to handle various questions related to that medications. Okay, so let's try to understand this point. Clonidine is contraindicated in sick sinus syndrome and heart block patient. Okay, as we had discussed in the previous class, what is the mechanism of action of Clonidine? This is the noradrenaline release, and this noradrenaline bind to the receptor, and that is alpha 2 agonist. And this block, this noradrenaline act on this alpha 2 receptors, stimulate these receptors and stop releasing the noradrenaline. Now, understand this noradrenaline has two important functionality. One is this noradrenaline is positive chronotropic and positive ionotropic. Okay, that means that increase the contraction of heart and that increase the heartbeats. Okay, this is the main and normal function of noradrenaline. But when we are giving the Clonidine is stop or reduce the concentration of noradrenaline. If that reduce the concentration of noradrenaline, that means that decrease chronotropic effect and decrease the ionotropic effect. That means sick sinus syndrome, those patients who are suffering from the AV node and SA node. Okay, SA node is weak, that is weak pacemakers. Patient is already suffering from this kind of bradyarrhythmia. If we are giving clonidine, that can significantly increase the risk of severe bradycardia and severe cardiac bradyarrhythmia. That's why must not have to give to the patient those who are suffering from sick sinus syndrome. Sick sinus syndromes means the patient has a weak SA nodes, okay, and is a similar heart block. The patient doesn't have enough contraction capability and the electric conduction. In that situation also, if we are giving the clonidine, that decrease the total concentration of noradrenaline and that decrease the effectiveness of that, and due to that the patients can get into big trouble if they have a sick sinus or heart block conditions. This is very, very important point that you have to keep in mind. Okay, when we are talking about catecholamines, specifically noradrenalines, okay, so depression may exacerbate, avoid in the patient those who are suffering from the depression related problems. Why? As we know, the biogenic amine theory, the depression has a major pathogenesis involved is lack of biogenic amine in the brain. And if we are giving such kind of medications, that can exacerbate the problems of the depression. That's why the depression patients should avoid these medications. Okay, in diabetes may cause a transient rise in blood glucose, it's okay. Severe coronary insufficiency, recent myocardial infarction, cerebrovascular disease, renal failure, Renault syndromes, vasospastic peripheral disease. In these conditions, we can consider these problems in two different ways. One is this is changing the sympathetic tone, and the sympathetic tone has a wide variety of effectiveness all across the body, and that's why the patient can get the major problems with a clonidine. Okay, like in Renault condition, beta 2 receptors are responsible for vasodilation of your peripheral vascular blood vessels dilated with the beta 2 receptors. When the noradrenaline concentration reduces, the peripheral blood vessels are becoming more constricted. Okay, in that situation, the Renault conditions and vasospastic peripheral vascular disease, they're getting worst. Okay, that's why the clonidine should avoid in such kind of situation. Okay, don't stop abruptly may trigger the severe withdrawal syndromes. Continue during the perioperative periods. If the patient is already taking this medication, they can continue use. Okay, in pregnancy and breastfeeding, the medication can consider it's okay if the patient doesn't have any other problems. Drowsiness, centrally acting, that's why the drowsiness can occur. Dry mouth, bradycardia, I have already explained. Constipation, headache, fatigue, weakness, these kind of problems are associated with the blood pressure change. Orthostatic hypotension can be understandable. Dizziness, fluid retention, sleep disturbance, impotency, okay, depression, nausea, vomiting. Okay, impotency is also associated with the sympathetic tone change. Now, gynecomastia. When we are thinking about the gynecomastia, what could be the possible reason? Okay, when clonidine is taken by the patients, that can change the dopaminic responses, and due to that decrease the dopamine, that increase the prolactin. Okay, that increase the prolactin, this increase the prolactin can cause a gynecomastia. That could be the one reason. Urinary retention, because urinary bladders, detrusor muscles, prostate, and also the sphincter of the bladder, all these are significantly affected with the sympathetic system. So the sympathetic system disturbance can cause the urinary retention. Exact similar way, the blood vision is also similarly affected because of the sympathetic tone. because sympathetic tone, that can your pupil size is change, and aqueous humor production, these things are mediated through the sympathetic system, and if the sympathetic system disturbed, that can cause the blurred vision. Raynaud condition I already explained, because the beta 2 receptor mediated vasodilation is impaired, and due to that reasons the Raynaud condition can cause the problem. Okay, liver and all of the side effects are pretty self-explanatory. 18 to 70 hours after abrupt cessation, the withdrawal symptoms can start. Characterized by the rebound hypertension. Rebound hypertension. Why this rebound hypertension happen? Because significant noradrenaline release, and due to that, the vasoconstriction and the cardiac output increase, and that can lead the severe hypertension and hypertensive crisis. Headache, flushing, sweating, insomnia, agitation, tremor, all these are associated with sympathetic overactivity. Okay, so we just have released the brake. Okay, when we were giving the clonidine, that was the brake on your sympathetic system. Now we have suddenly off the brake, sympathetic overactivity has excited, and due to that, the patient is getting the sympathetic overactivity related side effects. Gradual withdrawal over the days and weeks, we are going to manage to normally increase the noradrenaline level, and we can minimize this kind of side effects. Okay, that's the point. Now, the hypertension, you don't need to remember the exact 150 to 300 microgram, repeat this and this. Dose is not important at all at this point of time, but you have to broadly understand, for hypertension, you need to give the higher dose. In menopause patients, you need to give a lower dose. Diagnosis for the pheochromocytoma, you need to give a higher dose. Okay, let's try to understand what is pheochromocytoma through the physiological points. Okay, 300 microgram in a single dose. Okay. The first of all, we have to understand what is the pheochromocytoma. This is your central, this is your plasma. Okay. This is your central nervous system. This is your adrenal gland. Okay, adrenal gland. Now, normally, catecholamine or sympathetic substance like noradrenaline release from the center. Another support system is that release from the adrenal gland. Okay, that's the adrenaline. Now, these are the two different sources. So we have to rule out this catecholamine or sympathetic neurotransmitters are coming from this source or that coming from this source. Okay. Here, adrenal carcinoma or adrenal cancer that increased significant high level of noradrenaline, that is called the pheochromocytoma. Okay. If the patient has a problem in central nervous system and the overflow or overproduction of a sympathetic from the brain, we have to rule out it. How we can rule out? For example, 300 microgram of clonidine we are giving to the patient. This 300 microgram is stimulate your alpha 2 receptor, and that decrease the surge of noradrenaline. Okay. This decrease the surge of noradrenaline. If this happen, so how we are going to conduct the test? The first of all, we have to take the baseline noradrenaline level in plasma. Then we have to give clonidine 300 microgram in a single dose. After 4 to 6 hours, again we are going to take the level of noradrenaline. If noradrenaline levels significantly drop, that means majority of noradrenaline coming from the central part, not from the adrenal part. It's not from the adrenal part, it's coming from the central part. That means the patient is not suffering from pheochromocytoma. Again, if we are taking the baseline test of the noradrenaline concentration in the plasma. Then we are giving the clonidine injection, like clonidine, 300 microgram in a single dose form. After 4 to 6 hours, again we measure the noradrenaline level. If significantly drop down the noradrenaline level, that means the patient is not suffering from pheochromocytoma. The main cause of noradrenaline is from the central overactivity, not from the peripheral overactivity. But after 4 to 6 hours, if the noradrenaline level is not significantly dropped down, means is less than 50% drop down, that means the another source of noradrenaline doesn't affect by the clonidine, and that surge is continuously from the adrenal gland, and that is confirmation the patient is suffering from pheochromocytoma. This is very important physiology you have to understand, and clonidine is the most important substance for measuring the pheochromocytoma. We don't need any imaging or double check, and counter diagnostic test can be done with that. Opioid withdrawal, why clonidine is used, that is very important. Like when the patient stop taking the opioids, that means that's over release of sympathetic. Opioid withdrawal is increase the sympathetic tone. That means the patient is getting tremor, sweating, uneasiness, all these kind of palpitation. These kind of symptoms are associated with the opioid withdrawal. When the patient is taking clonidine, that is going to suppress the release of excessive noradrenaline in the brain, and might patient don't get this kind of withdrawal symptoms. That's why the opioid withdrawal can manage with the clonidine. That is a very unique user case. ADHD main source of medications are considered as stimulant medications like dexamphetamine. These kind of medications stay at the most important choices. But if the patient unable to take those kind of medications, then the clonidine can consider. Okay, that's the administration can mix with the sodium chloride. Drowsiness can enhance the effect of alcohol because all the centrally acting medications dissonance. So you don't have to change your position, postural hypotension kind of effect. Don't stop these medications suddenly. Withdraw over 7 days period to minimize the rebound hypertension. Beta blocker may worsen the withdrawal. Okay, because that can cause the problem. Stop beta blocker first, then taper clonidine. Okay, opioid withdrawal, monitor BP on a regular basis. Migraine prophylaxis and menopause flushing, still this medication is used, but evidence is limited. For pheochroma testings, plasma catecholamine before giving the medication and 4 to 6 hours after the dose. If the 50% noradrenal level has fallen, that means the patient normal, and if doesn't fall that means the pheochromocytoma. That's the point you have to keep in mind. That doesn't make any importance in your learning. Okay, so the different dosage forms are available. Another small medications, that's a methyl dopa. That's a methyl dopa mainly used for the hypertension. The contraindication in active hepatic disease, pheochromocytoma, we don't have to use these medications. Coexisting conditions, depression may exacerbate similar way like catecholamine concentration change, renal impairment. Category, methyl dopa is a good choice of medication for pregnant women, so this is a good choice. Don't worry about it. This is the side effects, light headaches, sedation, dizziness because of blood pressure medications have similar kind of side effects. This is very unique point that you have to remember. Okay, so the direct cum test, okay, false cum test positive, that is the point you have to remember with the methyl dopa. That's the hemolytic anemia. You just have to go through these side effects. Please don't stuck with the side effects and try to memorize all the side effects, because that can cause significant confusion in your exam preparation. Okay, the counseling point, the drowsiness and the headache kind of things can happen, especially when you start with the treatment, because the newer blood pressure, your body is adapt with the new blood pressure, and might you can like stabilize with this kind of side effects. Avoid driving and operating machineries during this period. This instruction need to be given pretty much all the antihypertensive medications. May cause a postural dizziness, so change your position gradually. Sedation increase with the dose, and prefer at the night dose, because if you are taking vasodilatory or this kind of medication at the night time, might be you can minimize the daytime drowsiness. Monitor blood count and liver function during first 6 to 12 weeks to monitor and manage like hemolytic anemia kind of problems can be minimized. Okay, done. And some of the questions that we have to quickly go through. What is the primary indication of clonidine? Clonidine is used for so many different purposes, but the primary purpose here is hypertension. Which cardiovascular condition contraindicated clonidine use? Sick sinus syndrome. We don't have to use clonidine. Why? Because your SA node is not proper and heart blocked. These conditions, clonidine should not be used. What syndrome may occur if the clonidine is stopped suddenly? That's caused the withdrawal symptoms with the rebound hypertension due to excessive noradrenaline release. Which class of drugs should be stopped before tapering clonidine? When we start reducing the clonidine, make sure we have to stop the beta blockers. How is clonidine used to diagnose pheochromocytoma? 300 microgram oral single dose need to be given, and we have to measure catecholamine and noradrenaline concentration before administration and 4 to 6 hours after. Okay, if the 50%, more than 50% reduction, that means the central system, and if it's less than, then might be the adrenal system. Okay, what should be monitored when clonidine is used for opioid withdrawal? For opioid withdrawal, why this use? Because of the opioid withdrawal related symptoms minimize, because a noradrenaline release is controlled with use of clonidine. But make sure we have to measure the blood pressure during this situation. What effect does clonidine have on prolactin during the breastfeeding? May reduce the prolactin secretion. Prolactin. Okay, this is, we have to verify at this point. Okay, I can make it in a correction. Name of the rare endocrine related side effect of clonidine: gynecomastia due to hyperprolactinemia. So this question need to rethink about it. Okay, what is the counseling advice regarding the alcohol use with the clonidine? May increase the alcohol effect, should not be used. How should clonidine withdrawal be managed? It's required 7 days. Gradually we have to taper the dose and wean off with the medication in 7 days time. Okay, what pregnancy category methyl dopa is good? A. Which mental health condition may worse by the methyl dopa? Depression. Okay. What test may show positive result due to methyl dopa? COM test, direct COM test. This is very important question you can expect in your exam. What rare liver related adverse effects seen in methyl dopa? Hepatotoxicity. You don't need to remember the dose, but just for your understanding. What is the maximum effective daily dose of methyl dopa when used with the other antihypertensive? These kind of questions you don't have to remember, because it's not practically possible to memorize all medications dose. What is the most common side effect associated with the CNS depression caused by the methyl dopa? Sedation. Okay. How should dosing be adjusted in the renal impaired patient with the methyl dopa? Use the lower dose. What class of antihypertensive does methyl dopa belong to? Centrally acting hypertensive. And monitor. Okay, what should the blood count and liver function monitor? 6 to after 6 to 12 weeks. Okay. So these are the questions that can re-emphasize your understanding about the clonidine. Why we have covered the clonidine here? Because the clonidine has so many different user cases. So you can expect these kind of questions in your examination. Okay. So thank you very much for joining today's class and have a great time. Thank you very much. Bye-bye.